Substance abuse can be another source of depression. Dietary deficiencies such as folic acid and B12, and gender is a risk factor. Females are at more risk to develop repression. Age, elderly, socioeconomic status, the income level, and lower socioeconomic status may be resulting in depression. Extreme weight, again, can be resulting in depression and social isolation, and people who live alone, although the cause and the consequence here is difficult to pinpoint, because do they live alone because they are depressed, or they are depressed because they are alone? So patient, when they are experiencing depression, will experience feeling of rejection, helplessness, and feeling of being worthless. Disinterest in surrounding and disinterest in events that used to be pleasurable, and the word for it is ahedonia or ahedonia, because the patient experiences loss of interest in previously pleasurable activities. Irritability, may even have suicidal thoughts, easily crying, and either lack of sleep or excessive sleep. Depression may occur during critical period in life, and it may affect growing up, like adolescence, or going through menopause also can be common, and also events such as retirement and entering into new work environment. So this all can affect the depression. So diagnosis, again, can be made by a thorough physical examination, and also questionnaires can be done, but physical examination, again, important, plus lab workup, because several conditions may be reflected as depression, again, as thyroid. So depression truly is the diagnosis of exception, because first of all, your job is to rule out an organic, a physical source of depression, then think about psychological, psychiatric illness. Besides the depression, the cohort of mood disorders can be also can include seasonal affective disorders, and again, the seasonal affective disorder is speculated to be related to circadian rhythms of the person, and the treatments usually is the same as the depression. However, some activities mimicking the longer duration of daylight or a day, bright light during the winter months may decrease the seasonal affective disorders symptomatology. Also, another disorder is bipolar disorder, which I wouldn't spend much time on it because it was well covered in undergraduate nursing curriculum. And just main thing here, in bipolar disorders, the genetic component certainly present, and the treatment may include mood stabilizers as well as antidepressants. Use of antidepressants in bipolar treatment is somewhat controversial because they may exacerbate the manic episode. So generally, the antidepressant medications work on somehow altering a pathway of communication between in the synaptic cleft, and different neurotransmitters may be affected by the work or by the action of the antidepressants. So here in this picture is its depiction of the work of SSRIs and how it occurs on the section D. The SSRI interrupt neurotransmitters relief and reuptake, neurotransmitter reuptake. So we do have in synaptic cleft sufficient amount of neurotransmitter which provides the halting of the depressive symptoms. There are three major classes of antidepressant medication: monoxidase inhibitors, which are currently very seldom prescribed because of the side effects and their possibility of adverse effects, such as overdose, can be very severe with this. Tricyclic antidepressants also almost not prescribed for depression, and some of them, such as amitriptyline, will be prescribed for the sleep disorders. So the mainstay of antidepressive therapy is SSRIs, selective serotonin reuptake inhibitors, and again, those medications work in the synaptic cleft, and they are inhibiting the reuptake of serotonin in this case. SNRI, it's some consider it as subcategory of SSRIs, but it's certainly a separate type of drug. They act quite similar by affecting the reuptake of neurotransmitter, but at this point they are covering quite several neurotransmitters, and they can cover norepinephrine, serotonin, as well as dopamine. So they may work not only on depression but also on disorders such as anxiety. Anxiety disorders is the condition that can be considered from deviation from normal. Normally, anxiety is a response to stress, and which induces fight or flight response in some individuals, but for others, anxiety may become a chronic problem. The individual may experience anxiety that is exaggerated or inappropriate to the situation. And anxiety before was called anxiety disorder as neurosis. It's truly the largest mental health disorder in the United States. Numerically, I mean, that's the biggest number of people affected. The cause of the anxiety disorder is again unknown with certainty, although genetic factors, stress, environment, biochemical alteration, and even physical causes can be pinpointed, and physical causes may be studied a little better. And in physical causes, things like hyperthyroidism may affect development of anxiety. So anxiety has several types and different manifestations, but one of the extreme manifestation of anxiety disorder is panic disorder. Panic disorder is state of extreme and uncontrollable fever, which we may call a panic attack. And it's usually very sudden onset and peaks in a few minutes, and the patient may experience a feeling of impending doom, and the patient would like to escape and run away from it. And also somatic manifestation may be present, such as diaphoresis, chest pain, tachycardia. Patient may experience nausea and dissociation. Generalized anxiety disorder, it's a feeling of excessive worry. It's a continuous state of mind to intense anxiety. It's not related to a specific event. Anxiety is called freeloading. It's a state of constant anxiety that may be leading even to somatic manifestations, again, such as nausea, vomiting, diarrhea, and dryness in the mouth, and again tachycardia. So all of this, like exaggerated states, and patient lives basically on the edge, always being ready for some impending drastic events. Post-traumatic stress disorder is the development of the reaction as a response to psychologically stressful event that the person couldn't control, and it was outside of normal human experiences. Disorder is a relatively new addition to anxiety disorders, and it may be observed in war veterans, also victims who are victims of rape, abuse, or survivors of natural disasters. So people who deal with extreme situations, such as policemen and firemen, are at higher risk to develop post-traumatic stress disorders. And symptom can occur immediately after the event, or they may be staying dormant until several months after the trauma. Diagnosis of post-traumatic stress disorder, again, includes thorough physical examination to rule out other physical or organic conditions that may result in the development of similar symptoms. And but diagnosis is established also by confirming the history of symptoms and making sure that there are no other conditions are present. Treatment may include stress reduction, hypnosis, relaxation, exercise therapy, biofeedback, also medications. Treatment with antidepressants may be beneficial, or anti-anxiety agents. Some studies suggest that rapid debriefing after being exposed to a traumatic event will have higher results versus debriefing after a few days when the event occurred. Obsessive-compulsive disorder is an anxiety disorder with two parts. Obsession is a repetition of a thought or emotion, and compulsion is repetitive act. And it affects the individual in a way that person cannot resist not performing that act or get rid of the thought. With OCD, the person is unable to stop the thought or the action, and behavior becomes some type of ritual, and thoughts or attempts to stop the ritual may lead to extreme anxiety. The behavior will become very time consuming, and in some healthcare providers, like hand washing, can become obsessive compulsive behavior. And also it may become disruptive to the job activities, such as someone who has a desk clerical job, obsessed with cleaning the objects or maintaining clean desk surface, or a nurse or a doctor who is obsessed with washing hands continuously. The treatment will include anti-anxiety agents, and sometimes SSRIs or even SNRIs may be prescribed for this, and results can be very reassuring with treatment with SSRIs. Also, psychotherapy at the same time will be also of benefit.